Hello, everybody. Good afternoon and good evening. This is Dr. Shiraz Farooq and Sydney Farooq.
Hi, how's it going this evening?
At the Booty Doc today, we're talking
Welcome.
irritable bowel syndrome, guys. Welcome to America and welcome to the Booty Doc show. Well,
That's right, we're bringing you America's best.
Colavan America. We are here at Colavan America. That's our surgical practice, and we're talking about the Booty Doc talk. And
That's right.
we'll be talking about the common thing that we hear, and that is irritable bowel syndrome.
Better known as IBS.
IBS?
You don't know that term?
I have heard that term a lot, actually.
So that's what I hear all the time.
Correct, guys. How is everybody doing today out in the world? We've been busy at work, so Sydney actually was not feeling well and was home, and I dragged her here to come to the office and do the show with me. So I'm very grateful. I'm very grateful to you, Sydney Farooq, for being here with us today.
Yeah, working from home is not all it's cut out to be because I don't think I rested very much, and here I am.
No, I was very upset that you were working and I wanted you to rest, but somehow that didn't happen. So I'm very grateful that you're here.
I'm feeling a little bit better now.
And we're in front of Facebook, Instagram, and YouTube audience to talk about IBS, which is irritable bowel syndrome.
Yeah, so if you're just joining us, this is our 4th episode of our talk show. So we kicked off this year starting in January 2023. We wanted to share educational materials with you guys, have frank conversations with a proctologist, and talk about, not medical advice, but just to give you some everyday knowledge on things that are uncomfortable conversations we know you don't want to talk about. You guys come to us eventually, but we're trying to get you here quicker because we know that you don't know what's going on and you want answers. So we're here to see if we can provide a little bit of that.
Yeah, as far as that goes, being a talk show, we wanted to make it clear that if you need medical advice, please go to your doctor or a provider for that. This is just a show for information, and hopefully we can entertain you as well with our conversation. So we're trying to smile and be happy at the same time.
So here we are talking about IBS. We'll get the show kicked off here. So Dr. Farooq, simply, what is irritable bowel syndrome?
You mean IBS?
That's right. Don't confuse
we heard this a lot, and there's IBS basically is kind of like the messy teenager of the digestive system. That's an example I give people.
That troublemaker. Can't really do anything about it. You gotta wait and see.
And don't know what's going on, and you're trying to figure it out. So basically, this is a conundrum or a combination of symptoms that when doctors hear that, or we see patients like that, we group that into a syndrome, which is irritable bowel, meaning the bowel is not acting good and is acting very funny.
Interesting. So when you say you group these symptoms, what are the symptoms?
Well, the symptoms that most commonly occur with this is, number one, abdominal pain, where you feel like your belly is hurting a lot. You may get abdominal bloating and abdominal distension. You may also pass a lot of gas or may feel like you're full of gas. And sometimes you'll have diarrhea, sometimes you'll have constipation, and sometimes you may have some mucus with your bowel movements. And those are the top 4 or 5 symptoms that we look for in somebody who's not improving and has these symptoms for a long time. And then we tell them that they have IBS.
I've kind of heard people talk about this before, where it's like when the doctor doesn't know what's wrong with you, then you have IBS.
Well, then you have a syndrome. And when you have a syndrome, that means that we really don't know what's going on and we're trying to find the answers. And in this group of symptoms that we see, a lot of patients fall into it. So a lot of patients may have diarrhea or constipation or a combination. And sometimes these patients can be labeled as having irritable bowel problems.
Okay. So basically, before we're saying you have a syndrome, maybe there's some other things we rule out, or how do we get to this diagnosis?
Yeah, so when you talk about diagnosis, I wanted to make this very clear. Now, there is another term just like this, which is IBD, inflammatory bowel disease. Wait. Yes, yes, yes. So IBD is different from IBS.
Okay, so what's IBD? Not to go into it since we're talking about irritable bowel syndrome, but
IBD comes from ABCD. But actually, IBD, inflammatory bowel disease, is when you have constipation, diarrhea, abdominal pain, distension, and other symptoms, along with pathology, which makes it a disease. You have bleeding, you have some other issue that causes damage to the lining, which is visible, and that causes severe problems. So then it becomes a disease. So a syndrome is just a collection of symptoms, but they're not so bad. And when they get really bad, then it becomes a disease, which is slightly different than IBS.
So when it's more clearly diagnosable, what the symptoms are related to causing some sort of negative outcome, like you said, maybe bleeding or some damage to the lining of the tissue, then you can designate it as a disease. But with IBS, you're having symptoms, but there's no cure,
pathology.
There's no pathology. You
know. So there's no actual visible damage to the lining that is easy to see. But we do suspect that some things are at play which are causing these symptoms. So it is still a lot of research going into it, and scientists all across the world are still scratching their minds and brains to try to figure out what IBS is and how do you treat it. But so far we have come across many symptoms, and when a physician or a provider sees these symptoms, we put them in a bucket called IBS.
Okay. Now, what are some of the things that you can rule out? Like you mentioned, if I come with these symptoms, then maybe they could be caused by other things. Maybe I'll get diagnosed with something else. So what are the causes or the main reasons?
So let's backtrack, okay? So what is IBS? In that, when we talk about the pathology, what we know so far is that this can affect the lining of the large intestine, not the small intestine, and it affects the muscles of the colon in some way. And this also is related to an abnormality between the brain and the digestive system. So there's involvement of the nerves that are inside the colon, and that causes irritation, and that causes problems.
So maybe I might be getting constipation because my muscles are contracting in my stomach or something.
Well, so constipation can happen if your muscles are not contracting, and that means that your bowel is slow and it is not pushing the bowel movement out. If your muscles are contracting more, then you have what's called diarrhea, and you have repeated bowel movements or poopy liquid coming out of you. And sometimes foods can also irritate you, and that's another issue that we find, that certain foods make the symptoms of IBS worse and some make it better. So we think that this is related to the lining of the intestines, the gut-brain axis, which is the brain and the gastrointestinal tract interaction, and also the food that we eat. So all three of them play together, and sometimes they don't play together. And when they don't play together, then you get IBS.
So basically the symptoms can relate to different parts of problems, like you mentioned muscles or the brain or
the food.
Right.
So all of them can cause issues, and these then present as symptoms like you were talking. What are the patients or what are the public want to know about how and what happens? And that's where constipation comes in, diarrhea comes in.
What are some symptoms related to muscular issues in the stomach? You already mentioned like diarrhea.
So you could have bloating and distension also. You could also have a feeling of malaise, sickness, nausea, vomiting. You could have palpitations, you could feel dizzy, weak, you could get dehydrated from diarrhea, or bloating and constipation can cause you excessive pain and nausea.
So those are like muscular types of
muscular
symptoms.
and it's difficult to say just muscular, but because here you have to understand that
They cross a little bit.
they cross over, the brain is sending signals, and if there's a problem with the signals, they're not matching with the colon, then you get these problems.
How can you tell if the food I'm eating is maybe more of a root of the problem?
So this is not an easy solution. For that, if you have IBS, that means that you have to eliminate certain things in your diet and then slowly start back on them.
Mhm.
So diets that have different kinds of sugars and proteins and carbohydrates have to be limited in certain quantities.
Mhm.
And for that, you need a physician or a dietitian or a nutritionist to help you. So these are issues where you need help.
Mhm.
And that's where professionals come in, and you have to talk to some people about all of that.
So maybe if I eat something and then I start having symptomology, we can work to retrace my diet and find out what's causing that.
Correct. Eliminating certain foods and then slowly starting them back would be one of the things that we could do.
Without going over my like 2-week summary of everything I ate, what would be maybe recommendations you would make that like are definitely like firsthand off the table things? You know, you start ruling out coffee or this or that.
Coffee is one of
I
those
know coffee comes
things
up a lot.
that gets into problems when patients have diarrhea.
Mm.
In patients who have constipation, coffee can sometimes help. So that's where the symptoms have
It's
to
very dependent.
relate to what you eat and how you deal with it, and that's where you need a professional to come in or to talk to you about all of that.
But like we tell our patients, don't eat high acidity foods or drinks, or you know, or the things you would rule out first or add to your diet. How would you change your diet?
So the common knowledge that we have in scientific terms nowadays is that you have to have food that is going to pass through you and help your colon and your small intestine grow and live.
Mhm.
So we have determined that that is divided into prebiotic and probiotic and then postbiotic foods. So
That one's new to me.
yeah, prebiotic foods are foods that will help to increase the metabolism and the digestion of the food of the and will help the bacteria live inside the colon.
So it supports the bacteria and the good stuff in your stomach that's helping break down the food or pass it along.
So that's what I want to tell everyone. Very important. We as human beings are made up of trillions of cells. Inside and outside us are also trillions of cells.
In fact, I don't know if I heard this somewhere or read it because I read a lot of weird science things. He can attest to that.
Yes.
But I read or heard that there's more bacteria in the body that there is like cells. So that we're really just a giant ball of bacteria.
Well, we're a giant ball of bacteria, fungi, viruses, and pathogens.
More than human cells.
More or approximately the same.
Look it up.
So what happens is that inside our lining. So think of the gastrointestinal tract from the mouth to the anus as one tube. Food goes in, comes out the other way. So in that tube, just like on the outer skin, we have cells and bacteria. Inside, we have growing cells, bacteria, protozoa, fungi, and other microscopic organisms that need food. Mm-hmm. So the food we eat feeds them also. So you're not just feeding Shiraz Farouk or Sydney Farouk, you're feeding trillions of other pathogens and other microorganisms that live inside you. So yeah, don't eat my hand. So those living beings need food. So the food for them has to be such that it's digestible, and that is called prebiotic food.
Okay.
So that is mostly fermented food. So the way what happens is that when you eat a hamburger, okay, or a pizza, bad examples because they're very bad for you.
Let's give a good example then.
Carrots.
Okay.
Okay, you eat a carrot. What's up, doc? Carrot goes inside your body, you chew it, then it goes through your small intestine into the large intestine. By that time, some of the carbohydrates and the proteins and the fats are being broken apart, and most of the carbohydrates go inside the colon where they ferment. So, if you know the concept of fermentation, which is like brewing alcohol, um, what happens is that it makes a gas, and that methane gas and other gases inside the body then are the food for the organisms that live inside us, along with other chemicals and short chain fatty acids and other um, chemicals that are very yummy for the tummy inside us, and that's how these organisms live. So if you eat something bad like a pizza or burger, and I was going to bring that up, what happens is that these foods don't have a lot of good fermentable carbohydrates.
True. So you're not getting as much good stuff to feed your
Yeah,
gut.
exactly.
Now,
And
what are probiotics?
so
Sorry.
probiotics are dead bacteria that we have cleaned up, and then these bacteria, no, I shouldn't say dead bacteria. These are live bacteria, okay? These are live bacteria that grow in fermented foods like yogurts and other stuff. And when you eat them, these billions and trillions of bacteria go inside and join the other bacteria, and they have a good party. And if you eat pizza, they don't have a good party.
Because there's no bacteria to hang out with.
Well, they are bacteria, but they're bad bacteria.
It's not. So you're not consuming enough or the right kind of bacteria to party with your
good organisms. So mostly in a burger there are very few probiotics. For probiotics you need certain foods like fermentable kimchi or kefir drinks or yogurt. So those have probiotic live bacteria that don't hurt you.
The good ones.
That don't hurt you. And when you ingest them, they help your other bacteria live longer and grow well and heal the lining of the intestine and make us feel good.
Now you mentioned postbiotics.
So there are also certain foods that help afterwards. And this is an ongoing research where we're trying to figure out what foods will help these bacteria grow. And these are words that we've made up of. So a combination of bacteria and food is what our gullet or our gastrointestinal tract needs. So focus on prebiotics and probiotics.
Pretend
mostly.
That I never mentioned the made up postbiotics.
There is something.
I'm just joking. I've never heard of that. I'm going to look it up. I promise you I'm not a doctor or a medical professional.
So the other thing I wanted to tell you, I am a doctor, but I'm trying to not give out medical advice, but just give out fun stuff to you guys about what to eat and what not to eat. So
like pizza and burgers.
No, don't eat pizza and burgers. Eat carrots. They're better for you.
Which, in fact, we had a carrot salad today. We bought some of these mixed carrots, so they're all different colors and shapes and sizes. It was kind of fun. It was the best salad
eating the
ever.
rainbow is what's important. So it's definitely important to eat food that is colorful, that has different kinds of nutrients in it, so that you get enough of the good stuff in you, including calories and other multivitamins and nutrients.
Now, we talked about kind of some muscular symptomology, some foods that can affect your IBS. You also mentioned the gut brain. So what's going on there? What do you mean?
So we also know that IBS or irritable bowel syndrome can get worse or can be aggravated with stress and physical exertion, as well as autoimmune problems, some medications, and some diseases, etc., can also have issues like that.
Even I've heard like people get nervous and then all of a sudden they're farting or they're
So that nervousness is actually your brain and your GI tract not working together, and that causes gurgling, distension, diarrhea, upset stomach, all of that. And we sometimes label that as IBS if the symptoms continue for a long time and we are not improving.
So we decide I have IBS. Then what do? I mean, how do we manage it, diagnose it, treat it? What's going on there?
So as we focused on most of the talk on the fact that this is a very difficult thing to diagnose and treat, gastroenterologists and specialists and colorectal surgeons and nutritionists and other doctors in various fields are all working together to help the patients. So a lot of times you may need to see various doctors for various things. For diagnosis involves getting a physical examination, complete history of what you eat and what you don't eat, how you poop, what etc.
So I might need a psychiatrist or a psychologist. I might need a dietitian,
neurologist, a dietitian.
Neurologist.
So
Okay.
a lot of things may have to happen together to help you find out and
Rule it
cure
out
you or
Sure.
treat you.
Mhm.
Cure.
Yeah, is
I
there a
should
cure?
mention-
I mean, if we don't know what it is, how are we gonna make it stop?
That's a good point. There is no cure for IBS so far. We only have ability
Are
to.
you young geniuses out there, especially the ones with IBS? It's up to you.
Yes, we want people to find a cure for IBS, but I think this is going to take a lot more time because what we are going to realize is that this is not just one small thing, but multiple things together.
Mm-hmm.
So you may require diagnostic testing like a colonoscopy, an upper endoscopy, CAT scans, X-rays,
Rule some things out.
stool testing, blood testing.
Right, because
et cetera.
maybe I have some bacterial infection or virus, so if I have a stool test, then I can diagnose and pinpoint something rather than saying I have IBS. So by
Sometimes-
some of these
sometimes.
things can rule out other options.
And sometimes those tests will help you find out that you have some of those things.
That's what I mean. If you're like, well, do you have IBS? Give me a stool test. Maybe I have something really specific like H. pylori bacteria infection.
Yes, correct.
So then we know, oh no, you don't just have IBS, you have something treatable and diagnosable, and then
True.
we can move on from there.
For people who don't know, a Helicobacter pylori is a bacteria in the stomach which can cause various problems, bloating, diarrhea, heartburn, acid reflux, and symptoms.
But it's common in third world country mostly. It's not a major issue.
It is most common in areas where there are a lot of people living together in poor environments where there's jam-packed people together. So you have contact with other people and food and stuff like that. So.
But I'm just using that as an example. You don't even know what it is.
Yes. So stool tests for some things can rule in or rule out. That was the point.
Mm-hmm.
The other thing is that when you talk about treatment for that may be a multi-modality issue where you may need to be on you may need medicines for like a stress relief, antipsychotic medicines. You may need medicines to decrease the anal spasm or make your bowels go.
Mm-hmm.
So you may need medicine to stop the diarrhea, or you may need medicines to stop or improve the constipation.
Right.
So those are medicines that can be helpful.
Mm-hmm.
Sometimes we also put patients on certain diets that can help. Food allergies have to be looked at, and
Sure.
Have
you ever taken a food allergy test?
No, I've not, but I have talked to many allergists, and they have to do hundreds of food tests, and it's a very comprehensive process.
Now, is this a common problem? Or are there a lot of people dealing with IBS? Or?
So IBS is a common problem, and there are millions of people in America and millions of people all across the planet who have bloating, constipation, diarrhea, and a lot of them may be diagnosed with this syndrome if they sit down with their physician and go from A to B to C to D to Z and get all the testing and diagnostic stuff done.
Mm-hmm.
And part of that is ongoing with medical therapy, with food therapy, with behavioral therapy.
Sounds like quite a process.
Yes. So think of this like you have to go to a wellness retreat for your gut.
Very true.
And part of that may be meditation, yoga, belly massage, relaxation techniques. Science is still evolving in this era, and there's a lot that we have to still learn.
True. Unfortunately, for those suffering.
Correct.
Well, I know that on a personal level, until you're educated, you really don't take care of things. You're not conscientious of what's going on in your body, what's going on out there in the world, what's going on with the person next to you. So it takes a lot of care and attention to educate yourself, learn about what it means to be a
Because we are talking about prebiotics. That's the food that helps you heal and allow your intestinal bacteria and other cells and organisms to live. Fiber is a very important part.
No way. No,
Yes,
you didn't.
I did, and I have to
Did
say it.
not.
So fiber is part
It's true.
of a plant that is either soluble or insoluble. The roughage, the fruits, the vegetables that our grandmas and moms are always pushing on us, that's the good stuff that we have to eat. Because when you eat those,
Do carrots have fiber?
yes, carrots have fiber. So when you eat food like that, that goes inside your digestive system, goes into the colon where it ferments, and the good bacteria are provided food, and they are provided other stuff that help them grow, and they're also food for the lining of the intestines.
Right.
So your food, so the fiber also is food for the lining of your colon. It may not have caloric value, meaning it doesn't have the definition of, it's going to give you energy, but it'll have nutritional value, meaning it is going to help you heal your lining of the intestines, or may help your cells grow or do various functions in the body. And this is information that is very important. I feel like if patients understand that if we eat more fiber, okay, if we are eating more fresh fruits, more vegetables, some of them are helpful and some aren't. So that's where you have to do a process of elimination with your physician or your dietitian and
By
figure
the
out
way,
how that'll work.
there's this whole national guide produced by who? Probably like the health organization. I don't know. We give it to all of our patients. It tells you all of the contents of all the different types of foods with how much fiber is in them, carbohydrates, sugars, etc. You can just straight Google this. It's like a library of information about foods. So you don't have to become a professional to think a little bit like, what are fiber foods? Let me look into it. Look into what those foods are about.
We encourage a lot of people. Okay, we have all heard the fable and the proverb: an apple a day keeps the doctor away.
Mm-hmm.
What it needs to be actually is 2 apples a day keeps the proctologist away.
Just a little trick for you.
Really, because an apple has about 4 to 5 grams of fiber. You eat 2 apples, you're juggling about 8 to 10 grams of fiber a day. Most Americans eat less than 15 grams of fiber, so you add another 10, you're up to 25 grams. You'll be smiling, your skin is going to thank you, your hair is going to be better. Add some flaxseed onto it or some other insoluble fiber, and
Ate my 2 apples today.
You'll see that'll make a difference. So fruits and vegetables will help irritable bowel syndrome, but some foods and vegetables will make it worse.
Depending. And that was the point I wanted to make, kind of what I took from this, and really what I've learned in my studies as a philosopher and a sociologist is that things are very subjective. We are not all the same one human.
No, everyone is different, and that's why the advice we give has to be taken with a grain of salt, because it may vary from person to person.
But the important thing is that you need to respect that about yourself as an individual and understand. So if you're experiencing digestive issues, look at yourself. Look at what are you doing in your life that's active, that's healthy, that's good for your diet, that's good for your mind. A lot of these things we talked about today: food, mind, muscular. So take care of your body.
Also,
make sure you're treating yourself right.
I have mentioned this before. We are mostly cucumbers with water. Okay, bags of bones
and bacteria,
and lots of water. So please hydrate yourself, because food includes water. So when you are drinking plenty of water, your IBS symptoms may improve, and that is something that can be helpful to a lot of people.
We got 1 minute here. So My last comment is be conscientious of what you're doing to yourself and your body, your mind, your heart, your digestive system.
And that's where I will also say the hashtag, it's a gut feeling. So why is that important? Your digestive organs are the ones that are involved in emotions. And emotions are basically neurochemical reactions that make us happy or sad, bloated, and stuff like that. So stay happy and
smile
today. And
we'll
you guys
see you
are
next
going to be
week.
okay.
Check our website, our social media to see what we're going to be talking about. We'll post it. If you have any questions, I saw a couple of you posting on there. Thank you so much for joining, everyone. Big wave.
Thank you, guys. DaBootyDoc
So we'll talk to you. We'll answer your questions.
Shiraz in Sydney.
See you
We're
next
just having
week.
fun with you guys. Take care.
Thursday, 7 p.m.
Thank you. Take
Good
care.
night.
Bye-bye.